So let's talk about the lumbar plexus then. The lumbar plexus is composed of nerve roots from T12, L1, L2, L3, L4, and L5. Now, in your mind, knowing what you now know about the conus medullaris, picture in your mind where these nerve roots are coming off of the spinal cord. We said that the first nerve root of the lumbar plexus is derived from T12. Well, the T12 spinal cord level is approximately at the level of the T9 to T10 spinal level. So these nerve roots descend down the spinal column as the cauda equina, and once we have the ventral primary rami, the ventral primary rami then divide into both anterior and posterior divisions. And the anterior division of L2, L3, and L4 combine to give us the obturator nerve. The posterior divisions of L2, L3, and L4 combine to give us the femoral nerve. The anterior division of the first lumbar segment gives us both the genitofemoral nerve, and then combined with a twig from T12, we get the iliohypogastric nerve, and then also the ilioinguinal nerve. So the L1 root has two named branches. Has the iliohypogastric nerve. This nerve is sensory nerve to the pubis and the medial portion of the inguinal ligament. The other branch is the ilioinguinal nerve. This is also a sensory nerve, sensory to the penis and scrotum in males, or the labia in females. Then the L1 and L2 nerve roots combine to form the genitofemoral nerve. The genitofemoral nerve is sensory to the skin over the femoral triangle and is motor to the cremaster muscle in the spermatic cord in men. So basically the L1 nerve root has very minimal motor function, mostly carries sensory fibers. It is motor to the cremaster muscle, and as we'll find out later, it may also contribute to hip flexion by way of its innervation to the psoas muscle. Then the L2 and L3 nerve roots, the posterior divisions, that is, combine to form the lateral femoral cutaneous nerve. Lateral femoral cutaneous nerve enters the thigh, the upper lateral part of the thigh, under the lateral part of the inguinal ligament, and it's sensory to the lateral thigh down about as low as the knee. We'll talk a little bit more about lateral femoral cutaneous nerve. The L2, L3, and L4 nerve roots, the posterior divisions of the nerve roots, then combine to form the femoral nerve, and the femoral nerve has many functions. The femoral nerve is sensory to the anteromedial thigh by way of the anterior cutaneous nerve. It's sensory to the medial leg, that is the lower leg, to include the medial malleolus by way of the saphenous nerve. And it's also motor to the iliopsoas, and in particular the iliacus portion of the iliopsoas. It's also motor to the rectus femoris, to the sartorius, to the vastus lateralis, and also the vastus intermedius. Then finally, L2, L3, and L4, that is the anterior divisions of those nerve roots, combine to give us the obturator nerve. And the obturator nerve, like the femoral nerve, is a mixed nerve, meaning it has sensory and motor functions. is sensory to the medial aspect of the knee, and it's also supplying motor fibers to hip abductor muscles. I'm sorry, hip adductor, ADD, hip adductor muscles, including the pectineus, the adductor brevis, the adductor longus, the adductor magnus, and also the gracilis. And those are known as the 5 groin muscles. Recall that there are 5 groin muscles that contribute to hip adduction. And those 5 groin adductor muscles are remembered by the mnemonic small, medium, large, extra large, and jumbo, and that is the pectineus, adductor brevis, adductor longus, adductor magnus, and then finally the gracilis. Then we have the sacral plexus, and the sacral plexus is formed from the nerve roots of L4, L5, S1, S2, S3, and S4. And it's the upper nerve roots from L4, L5, S1, S2, and S3 that give us the sciatic nerve. And it's the lower nerve root from S2, S3, and S4 that combine to give us the pudendal nerve. Now, the nerve roots from L4, L5, S1, S2 all come out and divide into anterior and posterior divisions. So we're seeing now a recurring theme taking place with nerve roots coming out and then commonly dividing into both anterior and posterior divisions. And in other programs we discussed this pattern as it's found also in the cervical and brachial plexuses up in the cervical spine. So it's the anterior divisions of L4, L5, S1, S2, and S3 that give us the tibial nerve. It's the posterior divisions of L4, L5, S1, and S2 that give us the common peroneal portion of the sciatic nerve. So interesting is that the tibial portion of the sciatic nerve has contribution from S3, whereas S3 does not contribute to the common peroneal portion of the sciatic nerve, and that explains why the S3 dermatome is independent of the common peroneal nerve. It's more associated with the tibial nerve. In addition to the tibial and common peroneal nerves deriving from the sacral plexus, there are a couple of important named peripheral nerves also deriving from the sacral plexus from the posterior divisions. From spinal nerve roots L4, L5, and S1, we have the superior gluteal nerve. That goes on to innervate the gluteus maximus muscle. And then a little bit lower down from the L5, S1, and S2 nerve roots, also again from the posterior divisions, we have the inferior gluteal nerve, and that goes on to innervate the gluteus medius and gluteus minimus. And then even further down still, arising from the posterior divisions of S1 and S2 nerve roots, is the nerve to the piriformis. And then arising from the anterior divisions, we have several sensory and motor nerve roots of lesser importance that we won't discuss here in this program, with the exception of one cutaneous nerve, which derives from both anterior and posterior divisions of S1, S2, and S3, and that's the posterior cutaneous nerve of the thigh. And we'll discuss that nerve a bit on here as we discuss, as we get into the AMA guides and permanent impairment due to loss of sensory function. There is permanent impairment provided for loss of function or pain in the distribution of the posterior cutaneous nerve of the thigh. In addition to those anterior and posterior divisions of those nerve roots, recall that we also have autonomic fibers traveling in the lumbar and sacral spinal nerve roots. We have sympathetic fibers coming off the sympathetic chain, bringing sympathetics to blood vessels, sweat glands, and erector pili muscles. Also traveling in the S2, S3, and S4 nerve roots are parasympathetic fibers that come out and form the pelvic splanchnic nerves and go on to innervate visceral structures within the pelvis. Again, so let's just summarize the sacral plexus, and that is that the sacral plexus is formed from the nerve roots L4, L5, S1, S2, and S3, and each of those nerve roots has both anterior and posterior divisions, meaning that as those nerve roots exit the spine, they then divide. They divide initially first into anterior and dorsal primary rami. From there, it's the ventral primary rami that then further divide into anterior and posterior divisions. And each one of the nerve roots of the sacral plexus has an anterior and a posterior division. All of the anterior divisions of L4, L5, S1, S2, and S3 combine to contribute to the common peroneal nerve. All of the posterior divisions of L4, L5, S1, S2, and S3 combine to contribute to the tibial nerve. The tibial nerve and the common peroneal nerve then become invested in the same fascia. They become conjoined by a common perineurium to form what we know as the sciatic nerve. And we're going to trace the sciatic nerve out of the pelvis down into the leg and ultimately onto its termination down into the foot. And we're going to follow potential sites that nerve can become injured, beginning all the way up high near the spine where it initially forms the sciatic nerve, all the way down to its termination in the foot, where it again becomes separated into both common peroneal and tibial portions of that nerve. So the sciatic nerve, or I should say the sacral plexus, gives us many important named peripheral nerves. And the sacral plexus, most of the named peripheral nerves of the sacral plexus leave the pelvis by way of the greater sciatic notch. And some of the main branches of the sacral plexus are the gluteal nerves. First of all, there's 3 gluteal nerves. Those arise from L4, L5, S1, and S2, and we have the superior gluteal nerve, the inferior gluteal nerve, and the nerve to the piriformis. From the posterior divisions of L4, L5, S1, and S2, we have the peroneal nerve, also known as the common peroneal nerve or the common fibular nerve. Sometimes it's known as the lateral popliteal nerve because it's found in the lateral part of the popliteus versus the tibial nerve, which travels down in the medial part of the popliteus. From the anterior divisions of L4, L5, S1, S2, and S3, we have the tibial nerve. And then, as we said, the peroneal and tibial nerves become invested in the same fascia. Now, an interesting fact, or an interesting finding, is that once the tibial and common peroneal nerves become invested in the same fascia, trauma to the now sciatic nerve causes injury or damage or symptoms in the distribution of the common peroneal nerve 6 times more frequently than it does in the distribution of the tibial nerve. In other words, the common peroneal nerve component of the sciatic nerve is injured 6 times more frequently than is the tibial component. And we'll talk about some clinical manifestations of injury to the common peroneal nerve, and we'll talk about some clinical tests that we can use to determine the location of a lesion to the common peroneal nerve. Then, as we said, the S1, S2, and S3 nerve roots, both anterior and posterior divisions, combine to give us the posterior cutaneous nerve. And then we have the S2, S3, and S4 contributions to give us the pudendal nerve. Well, what about the sympathetics in this area? The sympathetic trunk contains the sympathetic ganglia, and recall that the final sympathetic motor neuron, the autonomic motor neuron that arises from the intermediolateral cell column, the lowest one is found at around the level of L1 or L2. So let's presume that it's at the level of L2. And let's trace the fate of one of these single autonomic motor neurons. Recall it has its cell body in the intermediolateral cell column, and this motor neuron leaves the spinal cord by way of the ventral spinal root, the ventral root. Now, in spinal levels above L1 or L2, the autonomic motor neuron leaves the ventral root in the white ramus communicantes and enters the sympathetic ganglion. From there, the axon of this motor neuron can have one of several fates. One of those fates is that motor neuron makes a synapse in the sympathetic ganglia, and then the axon from that synapse, the postganglionic neuron, leaves the sympathetic trunk by way of the gray ramus communicantes, and we call them white and gray rami communicantes to indicate that the white rami communicantes are composed of myelinated nerve fibers, and the gray rami communicantes are composed of unmyelinated nerve fibers. Well, below the level of approximately L1 or L2, and in this example we're using L2 as our lowest level of sympathetic outflow, below the level of L2 we no longer see white ramus communicantes. We only see gray ramus communicantes leaving from the sympathetic ganglion, and the sympathetic ganglion continue to descend way down into the sacral region, where the left and right sympathetic chain join in the midline. And below L2 we only see gray ramus communicantes. So what does that tell us? That tells us that below L2 there are no more preganglionic motor neurons traveling in the sympathetic chain. They're only postganglionic neurons, and these postganglionic neurons exit the sympathetic chain through the gray ramus communicantes and then travel along with the spinal nerve root to their point of destination. And primarily when we're talking about the sympathetics, the sympathetic motor neuron fibers then go on to innervate somatic structures in the lower extremities, somatic structures that are under autonomic control, such as the blood vessels, the erector pili muscles, and glands. For example, sweat glands in the feet, or sweat glands in and around the perineum. And these sympathetic fibers travel in all of the spinal nerve roots and then continue all the way out into all of the named peripheral nerves of the lower extremity. And so therefore, with injury to any of the named peripheral nerves, which we're going to get into here shortly, we can expect to see sympathetic dysfunction. Just as we can have dysfunction of the sensory portion of the nerve, just as we can have dysfunction of the motor portion of the nerve, we can have dysfunction also of the autonomic portion of the nerve. And we'll talk about some of the clinical exam findings that you'll see when these autonomic nerve fibers are involved in the injury.